Across Yorkshire's moors and dales, the world's most famous vet set the benchmark for animal care. And James Herriot's legacy lives on. At his old practice in Thirsk,
Hello, Skeldale Veterinary Centre.
Standards are maintained by his former trainee,
Let's have a look.
Peter Wright.
Many years ago, this is what my old boss taught me to use, and it's done the job for me very well over the years. New life fills me full of so much joy.
In nearby Boroughbridge, Peter's former partner Julian Norton also upholds the Herriot ethos.
She's really pleased to see you.
I'm coming to save your legs.
And in the foothills of the Pennines,
Come on, lad.
at one of the country's busiest animal hospitals,
So cool.
a new generation of town and country vets are following in their footsteps.
Shona's just touched me through the cow, which feels very strange.
Hey, take one.
The vet teams have one common goal:
It's called the art of veterinary science.
to help animals of all shapes,
Quicker than I was expecting.
sizes,
Hello, dear.
types,
Yeah, I'm on, big boy.
and temperaments. It's definitely not glamorous,
Smells like mouldy cheese or something like that.
but it's varied.
Hello, Jane. I don't know whether I can.
It's rarely easy,
How did it escape?
but they continue the Herriot tradition,
They're a bit wild, the cattle up here.
treating all creatures great
Chill, chill, chill.
It's one of these jobs where you need your porridge before you start.
Here we are.
and small.
It looks perfect.
Agriculture has been described as our wisest pursuit. Farming, a profession of hope. For centuries, these custodians of the countryside have quietly gone about their work. From dawn until dusk. But while it's also been said that a farmer has to be an optimist, that's often put to the test, as Peter knows all too well.
Just had a call from a farmer, Joe. He's got a cow that's got a uterine prolapse. The uterine prolapse, farmers call them calf beds. The uterus prolapses at some point after the calf has been born. This is quite a serious problem, so I want to get there as soon as I can, really.
She's calved about half an hour ago, and she's carried on pushing after she's pushed her calf out. If not seen to reasonably quick, it could affect her fertility in the future, and, you know, if it gets caught and anything ripped, she could bleed out, so bit of an emergency.
Now, Joe,
Amen.
got problems?
Yes,
Now, little un.
I'll let you in.
Yeah, in these strange times, I better put my mask on.
Yeah.
Ah, she's done that good and proper, hasn't she?
Yeah.
Sometimes, if you're very lucky, you don't get all the uterus out. Sometimes you just get part of the uterus out, and then it's much easier. But as we can see from the length of this, it's all come out. Right, just before we start, I'm going to give her an epidural. Right, missus, let's see what that does for you. We might need an extra pair of hands as well. If we have a sheet or something either side, just to take the weight of it, it'll make life a lot easier. Do you think you could conjure up something like that, Joe?
I'll go and get a bag.
Great. Right, thanks, Joe. You can just open that one as well. Now we've got to start feeding. I just hope we've got a cooperative patient, because some of these suckler cows, they're not particularly cooperative. Yes, I've got to put force on, put control force.
On all farms, great and small, animal welfare is essential. Whether it's reacting to an emergency or making sure there isn't one. And over at Cannon Hall Farm,
Now then, boys, are you going to behave? I hope so.
Rob and Dave have booked a vital veterinary visit for some of their South American residents.
We've got our bachelor pack of young male alpacas in from out in the field. They're going to be therapy animals in Northern Ireland to help people with difficulties. But before they can go, they need a TB test to make sure that they're fit and healthy and that they can travel. We call them the Rat Pack. It's Sammy, Dean and Frank. Ow!
The Rat Pack are in high spirits ahead of Shona's arrival.
No shenanigans, please. We want your best behaviour for Shona, don't we, eh?
Good morning, Rob. Good morning, Dave.
Hiya,
How
Shona.
are you?
Thank you for coming.
That's all right.
It's not going to be a straightforward one, this one.
Well, I did think that.
Yeah. Dean and Frank, they can spit and they've been known to kick as well.
With the alpacas more Brat Pack than Rat Pack, old Blue Eyes has swung by.
I'm quite experienced at TB testing cattle. However, I have no experience of TB testing alpacas and llamas, so I've called in a bit of help of someone who is a bit more experienced to guide us along the way and make things a bit easier.
Morning, everyone.
Hiya, Julian.
That looks like a well-behaved alpaca. What I normally do is just do them standing up. 2 strong, brave men to hold them.
Well, we've got one. Where's the other?
Well, wood'll do. Wood'll be enough. You can put the
No,
kettle on.
I'll chip in. I'll chip in.
Dave and Rob tell me that these are dangerous and they're likely to kick us and spit, but I'm more in danger of being kissed to death, I think.
Early days.
Ow! Gosh, how teeth, hasn't he?
We did try and warn you.
Sammy first then, Dave.
Right, let's have...
Yeah? Down to that end. Come on, son.
So I just go in, just in there.
Sorry, Rob, I'm a bit close and personal here.
Oh,
It's weed on you.
oh no. Sorry, Shona.
It's foul, isn't it?
That smells, though. That's morning pee.
Smell
No,
that.
it's awful.
I think we've got 2.3 mil there, so really, really thin skin.
We're putting TB into the thickness of the skin to see whether there's going to be a swelling or not. That's very precise, well done.
Sam, you're brave. Yeah.
In 3 days' time, if you get an increase in the skin thickness at the site of this injection here, then that can indicate a TB reactor.
The results won't just determine if these animals can travel to Northern Ireland.
So 1 down, what, 4 more to go?
Well, 2 alpacas and I think there's 2 llamas
There's
to
2
do as
llamas,
well.
yeah.
So
They could affect everyone's future.
If any of these llamas or alpacas had TB, there would be a knock-on effect for other animals on the farm. Let's go up in order of danger.
So we're
Dean next.
Right, are you ready? Ah, that were all right.
So the number on the dial is the the thickness of the skin. The thickness of the...
it's 2.9.
2.9.
2.9, yeah.
Sammy's just checking you're doing it right. Look.
Yeah.
Oh, don't worry, Sam, we're doing a nice job, that's good.
Right.
Are we ready to clear?
Just like on Frozen, Rob, let it go.
But now the team really have to face the music with the leader of the Rat Pack,
Right, this will be the test.
Oh, no.
who likes to do things his way.
He's got a real attitude about him, this one.
Is this Frank?
And this is where it could all go wrong.
And she's not the most cooperative girl. She's paddling about. There we go. The uterus is back in, but it's not properly positioned yet, and I'm still not happy with it. I've got a bottle now, and I'm going to use this bottle as an extension on my arm to make sure that the uterus is properly everted. If it's not completely turned back as it should be, she'll strain and she'll push it out again, and that's no good. Lovely. Now I'm happy.
So far, so good, nearly done.
Theoretically, you shouldn't have to stitch them. I was taught that at university 30 odd years ago. and I don't know many veterinary surgeons that don't stitch them.
So today, how are we going to stitch it?
Yeah.
Right, okay.
I'm a coward at heart, Joe. She's straining, we don't have to push it out. So it's just a belt and braces job, this. Well, Joe's putting the calf on now to get its first milk, colostrum, which is very important for immunity and to protect against bugs that he'll come across in the big wide world. So this first drink is absolutely vital, really, for the well-being of the calf.
The trick is to mimic the teat with your finger.
Yeah.
And then flick the teat in and swap them. And then on we go. But it turns out he just likes the finger instead.
Now he's on, isn't he? Yeah, now he's away. He's having a good slurp away now. He's away with the job now. That's what it's all about, really. Lovely to see this. Lovely. As a veterinary surgeon, obviously, our aim here is to get the cow right. And this is the best bit, really, afterwards, when you've done your job and you're seeing the benefits of what we've done. We're seeing new life coming into action. I love it.
Thanks very much for that, Peter.
You're welcome, Joe.
Yeah, that's grand. Thank you.
Thank
Cheers.
you very much.
We're really chuffed with how Peter's got on today. There's no stress to the cow, and the calf's sucking away nicely, so hopefully we should be all right now.
At the Nicholson's farm,
Frank, behave.
Rob and Dave are cautiously approaching Alpaca Rat Pack bad boy, Frank.
Watch him. Should we get him in that? Oh, nice catch.
Excellent.
Easy, Frank. It'll all be worth it.
Hello, Frank.
Julian and Shona are TB testing Frank and some of his pals to see if they can become therapy animals in Northern Ireland.
Very precise.
So far, so good. Even Frank's behaving. I can't believe it.
But sometimes, for spitting mad alpacas like this rat pack, it's not a moray.
Give up, Dean. Don't annoy him.
Oh.
Oh.
Did he get you?
Yeah.
That's what Dean thinks
That was Dean's fault. He wound him up.
Okay.
Are we good to go?
Yeah, done.
3, 2, 1. Step away from the alpaca. Right, the next task is 2 young male llamas, Pele and Pedro.
Right, oh yeah,
Right?
good.
And these, I think, are a lot better behaved, but we might find that they're actually more troublesome.
Okay, well, let's hope so.
Hang on.
So that. Whoa!
What did you
Who
say?
said it was going to be easier?
That'll be good.
Look at that shoulder.
Oh, brilliant, that's even
Look at
better.
that, a perfect armpit.
Yeah. So I'm making a fold of skin and we're measuring how thick this skin fold is.
Are we about to be
Don't be
late?
alarmed, Julian, but Pepe's about to make you. Be a lovely cross.
It'd have some beautiful teeth.
That's better.
There you go.
Yep, done. One more to go.
This is the one we need now, isn't it, Pedro?
Right, I'll take
going
Ed.
for the egg?
Yeah.
Come on then.
Whoa, steady, Pedro. Ooh, steady. Right. Sorry, that was an over-dramatic
You're right there.
yell from me. We're all right.
2.15.
So the TB testing's gone really well this morning. All our patients have actually cooperated quite well. So we can only now just cross our fingers and hope that when we come to read the test off, everyone's clear and there's no signs of TB.
It would be a nightmare, wouldn't it?
Yeah. We'd have to report it to the government and they'd advise us what to do.
Let's not think
but
about it, Shona.
Let's not,
Yeah.
no, let's not.
Happy
They're going to be
thoughts.
clear, aren't they?
Yeah.
Thanks very much for coming down to help us this morning, Julian.
It's all right, no problem. It's one thing reading instructions, but if you can have another set of eyes, it's always quite handy, isn't it?
Yeah.
Brilliant. Well,
Thanks
if you
very
need me
much.
again, you know where to find me.
Yeah, brilliant. Thank you.
Cheerio.
We'll see you soon.
Bye.
Vets travel miles visiting all kinds of farms. And David's on his way from the animal hospital in Huddersfield to Kathleen Pearson's small holding because she's concerned about one of her rescue sheep.
George, he seems to be the ringleader of the 4 little Hebrideans. He's cute. He's just like an episode from Shaun the Sheep. He's into everything. Hello, Georgie.
But right now, George the sheep is paused.
This is a sick bay. We saw that he was holding his leg up. We noticed that he had a cut on the inside of his front leg. This pus coming out, hence I've called a visit out.
I'm not sure how bad the problem is at the moment. I know the owner's quite worried, so we'll have to see what we can do for it. Morning, you all right?
Yes, thank you very kindly. Yourself?
Yes, I'm very well, thanks. What have you got for me then? You've got George,
George,
is it?
yes, that's got a bad leg. And pus is actually coming from the hoof.
Yeah.
So.
OK, well, let's see what we've got. All right, George. All right, lad. All right. Good boy. Good boy. Let's have a look at it, shall we? Right then, George. The blue is just antibiotic spray. Looking at it, it's very swollen. Just trying to palpate and check the joints working OK, and there's no fracture or anything like that. Certainly, we've got an ulcer in the sole in the base of the foot there. And we have a wound up here. I'm not sure if there's been some sort of injury up here, and we've got more damage in there. It's quite a serious infection.
Oh, George.
Sometimes the infection gets to the lining of the bone, and it's probably going to need quite intensive treatment. Certainly, we need to be continuing on the pain relief, the anti-inflammatories, and I'm going to give a more targeted antibiotic as well. All right, lad.
Poor little sausage. So what's the prognosis long term?
Well, I think it's a tricky one to say at this stage. My only warning is it could be a long-term problem. It's definitely a bad infection.
It won't be fatal, will it?
I think with a deeper infection, some of them don't respond.
Oh.
Yep. There's a lot of swelling there, and the infection's quite deep in the foot. It's not fair on him if he is lame for it in the longer term, if he, won't get back to weight bearing. So, fingers crossed, but I've just seen a couple like that don't do well in the long term.
He won't go any worse. If he does, do I call you or what?
Absolutely, yeah. If you're worried about him, if you think he's too painful or anything like that, then just call me and we'll see what we can do.
Thank you very kindly. Well, I'm keeping my fingers crossed because it was very serious. Well, hopefully he could go out and enjoy himself and get himself into some other mischief.
It's a big day on Rob and Dave's farm. They're about to find out the results of Julian and Shona's TB tests on some alpacas and llamas.
They need a clean bill of health to travel to Northern Ireland to be therapy animals, and hopefully today we'll get that.
We're hoping for good news, aren't we, eh? If it's bad news, then it's bad news for lots of animals on our farm. We'd have to have extensive testing. If the results were bad, it would mean some of the animals would have to be put down.
Good morning, Beth.
How you doing? Shona, how are you?
All right, thank you. Are you?
I hope you brought your good news face today.
Yes, so do I, yeah. Yeah.
First up, the alpaca rat pack of Frank, Dean and Sammy.
Go on then, Sammy.
Sammy's queuing up, he's a volunteer.
Hello, Sammy. What we're doing is feeling the site where I injected it, seeing if that has swollen up. If there is a reaction, that means that the animal has tuberculosis.
Good lad.
Right, that's really good because this is the critical side. There's no lump at all there.
Oh, good.
I'll just double check the other side.
Yep.
Okay, that's fine. What's he doing? Oh, he's
Feed on me again.
It's on your boot. Just say he's the friendliest one as well. Right, Sammy, you're fine.
And with Frank and Dean both getting the thumbs up too,
That's fine, no lumps.
Right,
That's
what
brilliant.
let him go?
That's just what we want. That's really good.
Shona's hoping for a full house and calmer llamas.
I think these two are going to behave today.
They'll behave to a point. Easy, boy.
Don't start doing that. I can hear you. It's not a good day when you start covered in spit or muck, is it really?
It smells, doesn't it?
Yeah.
People
Right, they're
think
both fine.
Oh, brilliant.
Yeah, good holding.
Ready to let go?
Yeah.
And walk away.
Yeah. Step away from the llama.
All 5 are clear. There's no lumps in the skin, so that's fantastic. We've not got tuberculosis on the farm. It's a really good feeling. And I'll be sure to give Julian the good news.
Well, that's a huge relief, Shona. Thank you very much.
Yeah, it's one of those, isn't it? It's always a bit of a worry. So they'll be on the merry way to Ireland soon, won't they?
Yeah. It's obviously sad to see any animal leave the farm, but when they're going to be something like a therapy animal,
Yeah.
then it sort of gives you a warm, fuzzy feeling inside.
Yeah, it does. It's really good, yeah. Great. All right, we'll see you both later then.
See you later, Shona.
Cheers.
These llamas and alpacas understand a Yorkshire dialect. Let's hope when they go across the water that they understand the Northern Ireland dialect, Rob.
To be sure, Dave.
That's so bad. I've got to apologise to everyone in Northern Ireland for that accent.
When you spend so much time helping animals with injuries and illnesses,
Right, mister, let's give you an anaesthetic.
it's only natural that you start to wonder what goes on inside their minds.
Ready? Count to 10. 10, 9.
When you're waking up, Hector, the pain will have gone.
He's counting, isn't he?
He is.
5, 4. Stop counting.
Hector's ready.
Yep, he's so sleepy.
Nice and drowsy, aren't you?
Whether they dream of things, that's a different matter.
I think dogs do dream. I do.
Yeah.
Do you?
Every time my dog falls asleep, he dreams. His jowls go, his legs start twitching.
Sometimes with some of our chaps, they've actually been running.
Yeah.
But they seem happy when they're dreaming often,
Yeah.
don't they? They don't seem to have bad dreams, do they?
They don't have financial worries, do they? They don't have concerns over the future of, the world.
Where's my next bone coming from?
It's fairly limited to a bone and a meal and maybe, what's it called, mating.
Probably chasing a cat or going for a nice walk somewhere.
Studies found that they don't generally dream of their day and what they've done during the day.
That's interesting.
Yeah.
Being at home and not being in here, I suppose, would be a good thing for them to think about while they were under.
I think some dogs quite like the vets, though, don't they? So I'd like to think that all my patients were pleased to come to the vets. Oh, great, it's Julian again with his healing hands.
Who needs equipment when you've got Julian and his healing hands?
No, I don't mean like a messiah or anything like that.
No, who would make that claim?
No, I'm not saying I'm the messiah, but I'm just saying...
a very naughty boy.
You know what I mean.
It's 5 weeks since David came to Kathleen's small holding to treat George, the Hebridean sheep's infected foot.
It's been a very slow process. He's had to have lots of antibiotics. I'm hoping that David has a look at it and says, well, hopefully that he can actually go out.
Hi, you all right? Let's have a look and see how he's getting on. Well then, George.
It's definitely fingers crossed today, see what David makes of the situation. Is it better though?
Well, it's better in that it's draining, but it's still infected, isn't it? Yeah, so it's a bit disappointing, really. It has been a longer course of treatment, and we're still having problems. And unfortunately, the infection keeps coming up and down. There's dead material in there. And he's not going to be going out today.
So it's very disappointing.
Let's have a minute to have a chat. There's significant loss, you know, of the bone up there at the moment. So it's not going to improve with medical management. So the only option really, I think, would be, I think he needs a toe amputation.
Pardon? What?
He needs a toe amputation, I think. I don't think there's much else to do for him at the minute. If we weren't going to try and do this, probably the kindest thing to do would be to put him to sleep.
Oh.
With tricky surgery George's only chance, Matt's come to give David a hand.
Go on then, George. Right, so...
What is it? It's this front one, isn't it?
Yeah.
Wow.
Yep. There's a complete bit of bone loss there.
Oh, God.
Which is why I think we're going to have to go as high as possible. It's going to be a bit of a fiddly one.
It is.
Well, there was no option. The other one was to give up on him, which I never would anyway.
I think we've just got enough space and bone there
to
take all of that off. We might just be able to save him, but it's definitely a do or die for old Georgie.
Yeah. So he's just had his first bit of intravenous sedation. We're going to get him nice and relaxed, and then we can get him into position, kick him on his front.
Just put him on his side.
On his side?
Yeah.
So he's got the local blocking around the area that we're going to cut in.
We're just separating the horrible infected toe from the healthy tissue that we want to leave behind. If we take too much off, we don't leave enough healthy tissue behind to heal, and if we take too little off, there's a chance we could leave some infection in there. Ultimately, that would not be a good outcome. Good boy, good boy.
How does that look?
Yeah, I think that's perfect. Is that Dave?
He's been a good patient, isn't he?
He's doing so well, aren't you, George? Hey?
Is he coming round now?
He's still fast, all right. He knows there's stuff going on, but I'm happy with him.
And his owl's aim. Whoa!
Oh!
There's a good lad. Good lad.
I'm glad that's over and done with, and they've done a grand job.
He's got pain relief going forward, so it's up to you now, mate.
What's the percentage of it being successful then?
A good 70%. Right, keep an eye on him for us and make sure he gets his antibiotics. Any problems, give us a ring.
Grand. Jobs are good, as you say round here.
They do.
Good as you, Catherine.
Thank
See you later.
Take care.
You too.
It's turned out very well so far. It's just a question now of time.
In Boroughbridge, Helen and Chris are waiting to see Julian with their golden retriever, Jasper.
Jasper is 13 years old, just over 13. He's a family pet, really loved, isn't he?
Yeah. Lovely dog,
yeah,
fantastic
really,
dog, best
really
dog
good,
we've ever had.
Really good temperament.
Lovely temperament.
But recently, Helen and Chris have become worried about their golden oldie.
About a month ago, we started with a small lump in his mouth. We've been on holiday 2 weeks, come back and the lump's grown. So we decided to bring him to the vet to see, have a look at it.
Jasper? Come on, Jasper. That looks hard work. Oh, yeah, fella. And how's this lump then? You can see it from outside already, can't you, when he's panting? Yeah, you can see the surface is going sort of dead and slightly ulcerated. It feels, and it's got all the characteristics of a cancerous growth. It's appeared quite quickly. It's in the place where you see tumours developing in a dog's mouth. It's hard and it's kind of knobbly and rubbery. They're usually something called a sarcoma, which quite a nasty kind of cancer, but they get bigger and bigger and bigger.
Yeah.
And
they usually get to a certain point, if you don't operate early on, it's too difficult to remove.
Yeah.
They're often attached to the gum line, actually, and that makes it even more difficult to take it off in entirety. But this one, luckily, is kind of on the lip. So with some careful planning, it should be able to take all that off, you know, without leaving any behind. OK? You come with me, young man.
There we go.
And then I'll give you a ring a bit later on.
That's a good boy. A little bit apprehensive, I suppose, the look of his age, but, you know...
we've got to do
what's right, the best for him, and make him comfortable.
Yeah.
He's in the right place and he's going to be well looked after.
Yeah. It'll be a bit of a nervous wait, but I'm sure it'll be fine. Good.
Jasper's obviously part of the family. He's an old boy, 13 years old, so that always makes things a little bit more difficult. And some people think, you know, in an old dog, is it the right thing to do to go for an anaesthetic and surgery? My view, particularly in a case like this where Jasper's very healthy and happy, it's far better to do the surgery now rather than put it off, and then you're often faced with a much bigger problem further down the line where your dog's much older. So it's better, I think, to do today.
With Jasper being such an old boy.
So we've just got him anaesthetised, which is the first step, and then work out how we're going to take it off.
Nurse Liz's role is more vital than ever.
I'm listening to his heart and his respiration, and then just checking it's fine.
But while she's happy so far, Julian's having doubts.
I'm not exactly sure what I'm going to do to get it off.
Peter's made the trip back to Joe Mackley's farm.
Right, you two.
The last time I was here, there's a cow with a prolapsed uterus. Once the uterus is put back, usually, that's the end of the problem. But there's always a few ifs and buts in there, so I've just called in today to see how things are. How, Joe?
You all right, Peter?
I'm very well, thanks. Are you?
Yeah, good, yeah. She's just in here if you want to come and have a look.
Well, she's cutting away quite happily there, isn't she?
Yeah, very content now.
Yes. And that's her calf there, isn't it?
Yeah, that's Penny.
Well, she looks as if she's happy enough there, Joe.
She's coming on really well.
By crikey. But they soon grow, don't they?
Yeah. Yeah, she's filling out nicely, really, now.
Yes, she has.
Yeah.
Just what you want. I'm very pleased with how she is. She's feeding her calf extremely well, and the fact that she's feeding it so well would tend to suggest that she's good in herself, because if you have a cow that's in pain, what would say in Yorkshire, in rotten fettle, they don't milk. And if they don't milk, they don't feed the calf as well.
I'd call it a success story, really. It could have been a lot worse.
It could, couldn't it? No, I'm more than happy with how things are. More than happy. I think I've got a new mate.
Yeah,
here.
you found a friend. That's Lenny.
This is Lenny?
Yeah.
He seems to rather like my trousers. He's quite bold, isn't he?
Oh, yeah, he's brave.
It's nice to be popular.
Yeah.
All right, Lenny. Nice to be popular, it is. Yeah. Well, it's nice to see everything's OK with the rest of the herd, so...
Thanks a lot, Peter.
You're welcome.
It's been
Nice to see you, Joe.
Yeah, cheers.
And I'll maybe see you again. Oh, little Lenny, eh? I've got a new mate there.
In Boroughbridge, Julian and Liz are operating to remove a cancerous lump from 13-year-old golden retriever Jasper.
I'm hoping I can take it all off by cutting just within the inside of the mouth and preserve the normal shape of the lip, which is my plan A. If that isn't going to work, then I'll need to actually resect part of his lip, which would mean basically recreating a lip on the left side of his face. So fingers crossed plan A is going to work.
And for owners Helen and Chris's whole family, there are fingers and paws crossed.
We've got two boys that are a bit older now. We've had him since he was a puppy, and the the boys grow up.
He's got a sister, he's got a dog sister called Elsie, who's now fretting because he's not there. So she's worried sick that he's gone out without her.
I'm just really cutting around the lump. It's pretty imperative that we get it all. The main thing really is to keep the anaesthetic time fairly short. The key with older dogs is to get the surgery done nice and quickly and efficiently. Minimal trauma and minimal hassle. That's come off very well. Fair old hole. Yikes. But that's good. If there's a nice big hole, it means we've got it all out. This is Jasper's lump, so we'll get that off to the lab. I think it's been pretty lucky for Jasper that his owner spotted it quite early. If it goes unnoticed for too long, it can be really, really difficult, if not impossible, to fix.
Sure it is, because I only got...
Right. Oh, yeah, well done. He'll be all right in there, won't he, to come round? He just fits. Depending exactly on what the lab tell me, the prognosis should be pretty good. I'm pretty confident that we've got it all out, and that being the case, it should be a cure.
And to the relief of Helen, Chris and Jasper's slightly more exuberant sister.
Elsie, come on. He's a good boy. You're going in now, are you? Is that it? Have you done?
He's soon enjoying lots of love back home.
Hiya, Jazz. How are you doing? How are you doing?
Good boy.
He's doing really well after the operation. Yeah, he's been fine. Absolutely fine.
Yeah.
Eating, no problem at all.
I do spoil him and just give him a little bit of cheese when I'm making my sandwiches. You want a bit of cheese? There you go. Yes, it's your favourite, isn't it? This is a picture of Jasper when we first got him as a puppy. No, we found it. It's in
Our son Thomas keeps it at the side of his bed. Not a lot of difference, really, is there? Thank you.
You're a bit bigger. You've grown, haven't you?
You're a good boy. Everything's good. He's really happy, so if he's happy, we're happy.
At Kathleen Pearson's small holding, George, the Hebridean sheep, has been stuck in the sick bay after having his toe amputated by David and Matt.
Are you OK? Can I get a kiss?
Kathleen's friend Dale has been helping with the nursing.
That's right, yeah. There we go. Give him a wave.
George has been having medicine, which is very difficult to administer. However, it's very easy. All I do is put it in a piece of bread and it becomes a medicine butty.
Ever seen a sheep eat bread?
But he won't have white bread. He's picky. He has brown bread. It's been a long, long haul, but yes, it's a good day today.
You can go out in a minute.
And after missing out on this beautiful countryside for so long, George isn't about to waste any time.
Yay!
Way!
They're glad to get out, aren't they? Getting back to normal already.
Yeah, great. Very good. It's lovely to see them like this after all that time, and the vets have done a superb job on him. It's wonderful, so we're going to have a celebration. We're going to open a bottle of Prosecco and toast it all. Oh, look at this.
Running about.
Hey.
Look at him dancing.
Oh, he's jumping up and down. Because they're so young. So to see them so happy, it's been worth it.
Right then, Kath, it's a good day. Let's go open that Prosecco, come on.
Job's a good one.